As someone who's been involved in both science and medicine for many, many years now, I often get asked which career path is best. Now, of course, this is a very personal question, and I always advocate that whenever making careers decisions, we have to dive deep into our own core values to figure out what's most important for us and make sure that whatever career plans we have will satisfy at least some of those core values. If you're at an earlier stage of your career and you're thinking, should I go into a university degree that's medicine or a university degree that's more science-based, there are some key future considerations to make. The first big consideration is that medicine does give us a very clear professional label. Now, why is that important? Well, it just means that whatever you're doing in the future, you have a label and a particular set of skills that allows you to fit into well-defined roles. The consequences of that is that often there is more job security and things are more sustainable, because if you have that clear degree and clear clinical experience, there are some things that are open to you that perhaps are not available to those who are pure scientists. So for example, when I've been an advisor to companies around medical products and services, the fact that I have medical clinical experience as a medical doctor is beneficial for those companies. And that's not something I would have perhaps achieved had I been focusing on pure scientific research alone. Another key consideration for science is that when you get beyond a certain stage in your scientific career, you have to be very, very good at finding your own funding to continue your research. Now, this may be project funding, or it may be personal funding that will actually fund your salary. Ultimately, the vast majority of scientists who stay in research environments in academia, universities, are required to find their own funding, and this can be very difficult to sustain because the funding environments are highly competitive internationally. So realistically, this means that as a scientist, you become a little bit like an entrepreneur later on in your career, because essentially you need to be the one out there finding the funding to sustain your research position. And oftentimes there will be other researchers who depend on you for that funding stream, particularly when it comes to project funding within your research group. So if you're the professor in charge of that group, ultimately it's your responsibility to make sure that there is enough funding for years to come to ensure that the PhD students and postdoctoral researchers in your research environment in a university are going to have a salary. So these are just some of the considerations to make. Do you want to have a more exploratory career where you may have to pursue your own funding? Or do you like the job security of working in medicine, for example, where your skill set will always be required, always be needed, and you can tailor this to certain roles that require medical clinical qualifications?